Thank, thank you. Now, you ready for the marathon? It's going to be one. I'm going to try to hit most of the highlights on charcoal and then hit some on clay because they're somewhat similar. And then I hope I can just do a few things on aloe for all of you. But here, as you can see here on the screen, what's it saying? Activated charcoal is called the miracle of what? Adsorption. Do you know what it is? The difference between absorption and adsorption, I'm going to show you. Absorption is taking a sponge and putting water in it, but you can squeeze it out. Adsorption, like this is what charcoal does, and this is what clay does. Here's a magnet, and you just do this. This is the toxins, this is the different types of chemicals that are in the body or whatever may be there that doesn't belong there because it has a positive charge. Charcoal and clay have a negative charge. So anything that has a positive charge in the poison family picks it up and it doesn't let it go. Like adsorption does. It lets it go because it's just a watery type of thing. So it hangs on to it till it takes it completely out of the body. And that's the major thing you need to know about charcoal and clay when you're using it. And that's the other reason why you don't take it when you've taken some drugs. You have to have 2 hours on either side of medication so that it doesn't grab a hold of your medication and take it out for you. Okay. And here it is, adsorption. See the difference? One latches onto it, the other will let it go. Activated charcoal. Now, this is amazing about activated charcoal. This container right here that you see of activated charcoal. Now, what is the difference? Charcoal has the same amount of power, but when it's activated under a steam type of heat, it expands the molecules. So where this would do just plain charcoal, it'll still absorb the same amount of poison, but not as big a space. When they activate it, then it can go 3 times its strength, or 3 times its space, because it activates it, makes it bigger. So when I look at that, I go to myself, how in the world can that little thing cover that many fields? But it can. It's that excellent. And then it's FDA approved. Everybody asks that. Well, one of the things to know that since for the last over 100 years, charcoal has been in all of the kind of hospital situations, emergency rooms, and it is to this day, and it is in all veterinarian clinics. It's just that you don't know that. When you have to go in and you've got any kind of poison situation, or your animal does, they NG tube it down, and they take out the poisons as fast as they can do it to save the life of whichever it is, but they never tell you that. But it's still you can say the medicine of choice. Now, this is the thing to know about charcoal. It's not everything that you can use, but you can use coconut charcoal. Now, what's the difference between charcoal? I got all really worked up about coconut charcoal a few years back, and it is excellent, but you know what? It does the same kind of thing, except without having to steam it and make it expand. Coconut charcoal covers a pretty big field. Just the coconut shells is what they do. And then, you know, most of it's done at wood. At Uchee Pines, we had this big pit, and we'd make it ourselves. I've been in a situation where something happened, and I had to have charcoal, and I didn't have my charcoal with me, but they had a fireplace. I just reached in the fireplace and pulled out a piece of wood that was in there, scraped it off, mashed it up real good, and I was able to use it. And it worked just as good as any other charcoal that I ever had. Now, I haven't used animal bones, but they have been used in Africa and places like that. They will charcoal them and work. And I haven't done coal, but I've heard that people use it, so I'm not that familiar working with it. Now, here, I was so upset when I found out I couldn't have my burnt toast, because I always liked it, not real burnt, but, you know, a little burnt, because it's carcinogenic. And like steaks, people don't understand using the grills. When you put just a 3-ounce steak on a grill, the fat that comes off of the meat goes down, hits those coals that are in there, makes a chemical called benzopyrene. It goes up and filters through the meat. Very carcinogenic. I think it's equal to several packs of cigarettes if you were to, not saying it's lung cancer, but just giving you an idea on the level of the carcinogenic effect of it is like you just smoked a couple packs of cigarettes. That's how serious a 3-ounce steak is. And people don't realize that, and we wonder why so much cancer. Well, then it's the same way here for the pot. You burn something in the pot, I'm famous at that. You just throw it all out and clean it up good. Don't eat it. I never eat my burnt stuff, but you know what I do? I've always been, you know why? Because I'm multitasking and I forget what's on the stove. So when my husband comes home from work, the pot's out there on the steps. I always put the pot out on the steps, and then he knows, oh boy, there she's burned it again. And it's hard work cleaning them up, and that's why I don't want to clean them up. So anyway, now people can make a mistake like this, because I've had them ask me, is you don't want to do this at all. It has charcoal in it, but it has poison in it as well. So you do this, and you're going to have the other charcoal to save your life. So whatever you do, don't use any of these types of charcoals that would go in any kind of barbecue. Right here, F.P. Torrey, he's my favorite character. In 1831, he was at the French Academy, he was a pharmacist at the French Academy of Medicine. And he tried with his colleagues for years trying to tell them about charcoal. And they just said he was a fool. Nobody believed him. You know, they just thought he was crazy. So there was a big symposium. Now, some of it I embellish a little bit, and I'll tell you when I do that. Anyway, there was this symposium that he was supposed to talk at. So there was all the pharmacists and doctors and scientists that came to it. And this is back, as I said, in 1831. So when it was his time to present, he got up in front and he said, he sent a young man to the lab and he told him to get 15 grams of strychnine. Does anybody know what strychnine is? It's a deadly poison. You want to kill somebody, that's what you get, and stick it in their water or whatever, and they're going to drop over dead. 15 grams of strychnine is enough to probably kill, for sure, 15 people, but maybe 20. It's it's going to kill you. There's no two ways about it. So the man went to the lab, he brought it out, and we can just pretend here, and here's the strychnine. Then he took 3 tablespoons of charcoal, put it in a glass of water, mixed it all up, and he does this. Ladies and gentlemen, this is the 15 grams of strychnine, and he drank it down. And then he said, and this is the 3 tablespoons of charcoal, and he drank it down. Then he picks up his papers to give his lecture. Well, I don't think they heard a word he said. I imagine them all on the edge of their seat waiting for him to hit the floor, you know? And they were just all waiting for that, and it never happened. Well, he had everybody's attention. From then on, people listened to him. People started using charcoal. You know, I can just imagine all that in my head. I'm pretty good at doing that kind of thing. And so, anyway, he's my favorite, one of my favorite characters. So now, is it safe? It's pure carbon. It doesn't add anything to the body. It gives nothing in the body whatsoever. It just takes out what doesn't belong there. And it just knows what to take. Now this, please listen to this when you're using charcoal. It is better to use more than not enough. You know, some people just, and I'm not one that does this, they want to measure it just perfect, got to level it off just like that. Well, don't you do that. You just get a spoon in there, and I do a big heaping one. You know, I'm going to be much more on that side than on this side, because then I know I'm going to be protected, and hopefully it's going to take out what needs to be taken out. Let me see. I'm going to try to just hit some of the important things. You have, which is nice, you have all my slides in here. So you can follow through in your book, and if anywhere you want to add a note, you can go ahead and add it. I get asked this all the time, and we did some tests at UC Pines to see, is it taking out good organic minerals? And no, it is not. We test the urine, we never did see that it was taking out things that were good minerals, good vitamins. We never did see that. Conditions never end. This is just the tip of the iceberg right here. Very good for nausea. If you're really nauseated, mix yourself up a glass full of it. And if you're nauseated to vomiting, then you will vomit many times after you've taken the charcoal. Don't panic over that. Don't try to keep it down because it's latching onto whatever's wrong in the stomach, and so you're going to throw it up. Then as soon as the stomach settles down, then you can go ahead and take another glass and do the very same thing. The same thing for diarrhea. You go ahead and you do a glass, and then you go to the bathroom, and you wait till things feel comfortable enough, and then you go ahead and do some more until finally you stop the diarrhea. And so it's really good for that. I'll tell you about the cholesterol thing. Gas, now, if you have intestinal gas from the cabbage family, from beans, that kind of thing, some people do. I tell them, don't worry about, well, is it going to interfere with the food I take, or is it going to cut it down? Well, it might cut it down a little bit, but you can take a tablespoon in some water before you eat, 15 minutes or so before. And then after you finish your meal, if you want, go ahead and take some more just to cover both ends of it, and then it'll help with the gas. People get a lot of good results with the gas thing, and then eventually, if you eat beans long enough, eventually your body will build the enzymes to handle the beans, and you won't have as much gas. And then there's a few ways that you can cook them. Inflammation, I mean, it's fantastic for inflammation. I can tell you a story on dialysis. I had a patient who already had the shunt in, and she was like, I think she was close to 80 years old, and she was pretty sick, and so she was my patient. I took care of her. We did charcoal poultices on her kidneys. I did charcoal baths on her. She drank charcoal, and one thing about the dialysis situation, you have to get their protein content in their food is below 7 if possible. So the lower they take in protein, the better results you have. Well, to make a long story short, in a sense, God saved her kidneys. Her kidneys begin to function again. In fact, we had another man also was a diabetic, and the same thing with him. The only thing that happened to her was she was from a very well-to-do family, and they were all going on a cruise. And she tells me that the day before she leaves. I said, you can't do this. There's no way you'll stay straight on a cruise from what I've heard about them. I said, and look, we just got you well. And the family was just praising us and thanking us that they were saving their mother. And they went on the cruise. And so you know the rest of the story. She ended up having to go on dialysis. Unlike the other man, I remember we did the same thing for him. He moved back. He went back to Florida where he was from. So when Dr. Agatha and I went down there to do a camp meeting, we contacted him to see how he was doing. And this was several years later, and he was still doing great. He really stuck to the program. And I'm talking, they all had their shunts ready for dialysis, and God was able to use these simple remedies to be able to reverse that for them. And so when you're serious about things and you're really going to follow what God says, you're going to get God's blessing. It's almost like resurrecting them from the dead because they're getting close to it. And wonderful for brushing the teeth to whiten them up. Good for gum conditions. So is clay. Clay is very good for that. Poison overdose. Now, these are my favorite little guys. I always wanted a monkey when I was a child, and I used to beg my uncle, who was a seaman, to bring me back a monkey. He never told me till I was a grown woman. He said, Valerie, I couldn't bring you back a monkey because it was too expensive, and they had to quarantine them and all that. But I had a broken heart while I was a child because Uncle Jim would come home and he wouldn't have the monkey, So anyway, these little guys, they lived in the southern part of Africa, and there was a big flood and rains came, and it flooded that area so severe that this group of little monkeys were pushed right off that part of Africa, and they pushed them. The flood took what didn't kill them out to some little island further out, and that was the end of them in that part of Africa. However, they ate from a specific tree that gave them most of the nutrition they needed. On this island, they didn't have those trees, but they did have mango, and mango trees, the barks and the leaves and so forth that they would eat was poison to these little guys. But you know what, and I just know God had to work in this, is that they went to the campfires, because they did a lot of campfires back there, and here you can see them eating charcoal. They would go in the trees, they would get their food and fill their tummies up because they just loved the mango leaves, and then they would go to a pit and they would get the charcoal and eat the charcoal. And I thought, isn't that amazing? But I really believe that God did something in their minds and showed them where to go get it to save their little lives. The same thing happened to giraffes. They lost the trees that they were eating to sustain them, and their bones were getting weaker and weaker, and finally they started eating bones. And as giraffe is vegetarian, but the only way they could get calcium anymore, because the trees had all died that they were eating off of, they started eating bones, and then their legs got strong again, and their bodies got strong again. Well, how did they know they could go eat a bone and get calcium? I believe the Lord just guides his animals. He loves his animals just like he loves us, because he's the creator of all of it. So anyway, let's see. We talk about medication. It's always 2 hours before and 2 hours after if you're going to take charcoal. If you take it too close, guess what's it going to do? It's going to absorb it, yeah. So you don't want to do it. You have all this. I suggest capsules are the best. The only thing I've ever used tablets for is if you got a toothache or an abscess in your mouth, you might want to melt down a tablet and put it right in that area. The powder is much quicker into the system. The only time I use capsules is when I'm flying or when I'm driving, because you never want to dip in this thing and think you can get charcoal out and mix in a glass of water. I mean, everybody's going to throw you off the plane, because the charcoal is just going to filter through the air and get onto everybody. But I don't go anywhere in the world that I don't have my charcoal. And I carry those capsules just in case for any kind of emergency. I have them with me. And really, if you want to make a poultice and you don't have the powder with you, just open up the capsules and you can do the very same thing. So anyway, we won't go over this right now so that I can get into the demonstration. This you can do, and the formula is in there in the slide, for your cholesterol and triglycerides. However, and we've seen it work, where you take 1/4 of an ounce 3 times daily for 4 weeks, and it lowered LDL 41% and triglycerides 76%. I mean, that's really good. But this is the caution. You can't be shoveling the other food in your mouth and taking the charcoal and thinking it's going to work. You got to straighten up your act and quit eating fats and sweets and things like that raise your cholesterol and raise your triglycerides. So if you follow a good program and you want to affect this in your body because it's serious, then this will work for you. We've seen it work. But you can't, some people think, well, man, I can keep on eating what I want and just take this and I'll get it down. It won't work for you that way. All right, so now what I'm going to really do, I've had number of poisonous cases and saving lives with charcoal. I mean, I've seen it do marvelous things. But what I want to do first, now this is a slurry water. Anybody know what slurry water is? I have put the charcoal already in here, and it has gone to the bottom, and then this is, you can see through it just about, it's light gray. Some people, when they start taking charcoal, this is how they want to start taking it, just to see how it works. However, on my neonatal babies that had jaundice, I would feed it to them in their bottles. I would strain this one more time through a paper towel or through cheesecloth, and then I would give it to them. And I'm talking about newborns, day-old babies. I start doing this. And I would also soak them in a charcoal bath, and then if it was warm enough and I could get sun, I would put them in the sun for a little while. Usually they were pretty good within 3 days. And so and children, let me tell you about this with children. If you start your children out, it doesn't matter whether anything's wrong with them or not, start teaching them to take these things when they're little so that when they do need them, it's not a problem. But the way you can do it even for the older ones and even fool older ones is you just get grape juice. And you just put the charcoal in the grape juice, you give them a straw, and they don't even know what they're taking. And that's a good way to slip it in. However, I just do a heaping tablespoon in that, and I just drink it on down. but it's a good way, steps to start. You know, you can't always just hit people with it at one time. You know, you got to work you up. But I had a patient who had a child, and she started using, by the time he was a year old, she was giving a little bit of charcoal at a time, giving him clay, giving him all kinds of natural things, and that little guy used to just amaze me. He would take anything you give him if it was natural. He was so used to it, and really as parents, that's the thing that we need to do. Now, what I'm going to show you is how to make a compress the way I put it together, but it's just generally the thing, is we use chucks. I tell you, when we discovered this at UG Pines, we thought we had a little taste of heaven. Because before we did things with paper towels and rags and, you know, saran wrap, and oh my, it was a real challenge to get it all right. And when we found these, oh, we thought, a little bit of heaven. Now, the thing I want to show you is you always want to get the chucks in it. I have some, I brought them with me because people asked me for it, is you want to have it to where this piece just comes off of that really nice. And it used to be, I could go to any Walmart or any of those places and get chucks, and they were really good. And then one day, I bought the chucks, and this is what I ended up with. I tried to get it off, and this is what I got. You see how that is? You can't put it in there. It's a mess. Can you all see what I'm doing? It's just a big cottony mess inside of there. I was devastated. I ended up going to another drugstore and then another drugstore, and I couldn't find the nice ones anymore. So, but I use these if I'm going to do a castor oil pack, if I'm going to do clay, because clay you put on the top of the chuck. Charcoal, you're going to put it between the chuck, and you'll see what how I'm going to do that. And almost any other compresses that you'll do. So now how I mix it, and you want to use glass to make it in, or porcelain, and then you want to use wood if possible, or even plastic will be better than a metal spoon. A metal spoon will cause a discharge in the electrical charge of the charcoal, or especially clay. Okay, now you know I'm pretty heavy at what I do, so here's how I do it. I put that much in, and then, especially with charcoal, you want to put some ground flaxseed. And the only reason that I do that, I think I'm going to put about that much, or you could put chia seed, anything that's gelatinous. It's not giving any benefit necessarily to the charcoal, but it makes it nice and gelatinous, it makes it soft, and it holds it together. Because otherwise, when charcoal dries, it dries and it goes everywhere and it breaks up and it's a mess. And if you have a very painful inflammation, the gelatin, making it like Jell-O, it feels or like pudding, it feels real soft and nice against, and you can mold it around the sore. So now, this is the next thing that's very important. You don't want to dump water in. If you do, it'll just go everywhere. So you want to just pour a little bit like that. And then you don't stir like this either, or you'll have a mess. And so I just move it a little bit, and then I see, okay, it's taken up that water. Now I'll put a little bit more. And what's nice about this is if I got too much water, which I might have done that this time, you just add a little bit more charcoal or a little bit more flaxseed. You know, and you can keep on. I did that one time trying to make pumpkin pies, and I had 19 pumpkin pies when I got done. I had to run to all the neighbors to borrow pie pans and cake pans, and I tell you that story one time. That was something else. My husband came home, and I had pies all over the counters, all over everywhere in the kitchen, and he said, "What are you going to do, feed the whole town?" And I said, well, I just kept adding to it, and it got soupy, and so I put more. Oh, it was a time. So anytime he sees me doing anything like that, he said, "Are you doing the pumpkin pie thing again?" I did that with a few other things, too. If I have time, I'll tell you those stories I'm telling you. I laugh about them now. Then I kind of cried a little bit, but and I had a whole bunch left. And I thought, what am I going to do? I went behind the pond and dumped it in the pond because I didn't have any more pots. You know, I was baking it in in loaf pans and pie pans and cake pans and you name it. Oh, that was when I was first married. You know, I did a lot of crazy things. Some of my cooking was something else. I baked some cookies one time. I did my aunt's recipe, and they swelled up in the oven. And I thought, what in the world happened here? They were this high, and they were all swelled together. And I said, well, I pulled that out and threw that in the trash can, and I kept on doing that, doing that. Anyway, my husband came home, the whole thing was filled up, and he's asked me where the cookies are. Oh, boy, I've had some. Those are for really cooking school. I should be telling that, but every now and then. Okay, so here we go. This is what you want the charcoal to look at. Now, just see that? Just nice and soft as it can be. And you can put it over the most inflamed, painful area, and it won't hurt you. So now, for those that can't see down, I'll hold this up. This is what I do. Anybody got a hurt area, we can put some on. Let me do this. And then I spread it. And depending how thick you want to make it, when my friend's dog that she dearly loved got bit by a rattlesnake in the head, she panicked, you know, because if you ever get bit by a snake in the head, you'll be fortunate if you make it. And so she panicked, and she made one about this thick to put where he was bit. His face swelled up that you couldn't even tell it was a dog. It was awful looking. And she did what she shouldn't have done. She she used a baster, and she squirted it down his throat. And you never do that if they're getting unconscious, which he was, but she just was in panic mode. Make a long story short, he lived. He lived. Believe it or not, she kept changing those compresses. So now here it is. It's over there. Now this is the way I do it, and it's, in fact, I was telling my husband my little kitty's breast swelled up from not nursing. So I had him doing a compress last night and saying, now, do you remember how I do the masking tape? Now, I use masking tape. We used to use, you know, hospital tape. Well, that can really get expensive. Just use masking tape. So you put it, let me just put it down here, and then I'll pick it up and show you. You have it like this on the edge. Do you see how I have it? But this is the trick. You turn it all the way over like this to where you don't see that masking tape at all. Do you see what I'm saying? You don't see the masking tape on the top. And the reason being is because masking tape's a little abrasive. You know, and so you just, if you turn it all the way over, then it won't touch that inflamed part or your skin. It can just irritate your skin. So I'll get that done, and then I'll pass it around. You can look at it. And now, I have up here, only because I don't like to fool too much with poison. You know, it's a scary thing. I had a little boy that almost died on me once. And so here's how it's done. I'm going to pass it around so that you can all see how I've done it. Now, the other thing that I do, I never walk, because I've had a few close calls in my life, I never walk or hike in the woods anymore that I don't take charcoal compresses. So I do a couple compresses, and I also get a small bottle, maybe this size, and I mix up charcoal and water already in it. So that if I encounter a snake biting me or whatever, then I can at least put a compress on it. I can drink the charcoal, and then I can walk slower, because if you, depending how deep you are in the woods, you have a distance that you may have to go. You don't want to run, because if you run, you're going to get the blood circulation going too fast, and that in and of itself will kill you. But if you do what I say, and you put that on, and you need to probably take a little piece of ace bandage or some tape with you that you can tape it on, then you can just walk slowly to get where you need to go, and you still need to go to the emergency room, you know, and get the antidote for whatever has bit you. Anyway, I can also tell you what to do for flu shots at some point in the meeting. I don't know we want to put it on record or not. But I have a lot of medical people coming to me and saying, I don't want to take the flu shot because, you know, they are dangerous. I mean, I've never taken one, and I'm not going to take one. And I know the things that they can cause. And I will tell you after this is cut off. What you can do, I just got a call, and they said, Valerie, we got people that need to know how to do this. So we have a formula for the medical workers, because I was just told by a medical worker that you can pay $1,000 and not have to take it. But then I found out they won't give you back your $1,000. See, you know, in other words, you're not going to get away with it. You're still going to lose your $1,000 no matter what. And so, but I can tell you what you can do so that doesn't get in your system. Okay. Where are we at? Oh, and then you can brush your teeth, as I said before, and I do that off and on. I split up between charcoal and clay. Clay is very good for the gums. And then if you have a room that you want to control odors in it, and of course you know to put in your freezer and refrigerator, don't you, charcoal? You just put it in a little jar like this and punch holes all in the top, and you just sit it back in your freezer or your charcoal. You put this behind your furniture, and it'll accumulate all the odors that are in the room or in the fridge or the freezer. And so that is another nice way of doing it. Now, if your pets get sick, you can make up the charcoal. If you can find a syringe, somebody would have a syringe, you can just draw it up like this. Well, this is the water. Let me show you. And I've done this more than once. My poor cats, I tell you, I put them through it sometimes. What's Mommy giving us now? You can just draw it up in a syringe, you know, and you never shoot it in their mouth this way. You go from the side of their mouth and shoot this in, and they will get wonderful results with charcoal. If you don't have that, you can use an eyedropper to go ahead and put it in. I'm going to talk a little bit about clay. I love clay, and I do have some extra French clay here, but I want to show you this, and I want to pass this around. With clay, you know about baby powder? You've been hearing it on the news? Well, I've been telling people that for the last 10 years. I have had a friend that recently died, and I questioned her privately, were you using baby powder? She said, I use it every time I take a bath. And she died from ovarian cancer. And so all different women that I know have ovarian cancer, I ask, and it seems like inevitably they've all been using baby powder. But I used to tell people that, and they just laughed me off. And it can also affect your lungs if you're putting it, you know, in your hair, for the oil in your hair, it can affect it. But you can buy clay, and this is kaolin clay. It looks just as white as it can be. And you just put essential oils in. I don't know. I like jasmine, but I made another clay powder the other day, and I just used my French green clay. I love French green clay. That's the famous clay that they use in all the spas, is French green clay. And so you just can buy the clay, and you can use any kind. And I experimented just to see, could I do that? And I can. And then you just do this, swish it all around, as you can see. Oh my, it smells so good. Anybody? If you want to powder yourself, there's a little powder puff I put in there that you can use that for. Now the other thing, let's say you don't have chucks. You know, you can use gauze, you can use a Band-Aid, you can use a rag, you can make a compress out of a paper towel. You know, any way that you can get it on, you put it on. Just remember that with charcoal, it's between something. With clay, it's straight on the skin. And the whatever type of bandage you're using, that goes over top of it. Now, one of the other things with charcoal, now it's never happened to me, but I've had people say it's happened to them. You have a cut that's got infected. The only way you would use charcoal on a fresh cut is if you're worried that it could picked up some things that, you know, could make it get infected, whatever, you know, whatever sharp instrument. You could do a wash with the charcoal. Just run the charcoal over it and wash it out good. But you don't need to put charcoal on a fresh cut because guess what? It's nothing wrong with it yet. It just needs to heal. And so healing, so then you would go to like aloe. Aloe is a cell proliferator. It will heal itself as well as heal you. It's a wonderful product. Has anybody ever used aloe for different things? I mean, it's a wonderful, and what I mean by a cell proliferator, so is comfrey. I've got some comfrey here. You'll see that on tomorrow morning. It causes the cells to heal much, much faster. And so it's a wonderful thing to use. In fact, it is also, it's good for cuts, it's good for sores. We've used it in certain tears during delivery. We use comfrey pores, and then we use aloe on the torn area or cut area. And I tell you, I've never seen things heal so quickly with those two things. It just amazes me. I remember this one delivery we did. I went to get the stitching kit, and Dr. Atkins said, nope, we're just going to do comfrey pores and use aloe. And I thought, oh my dear, I don't know if this is a good idea, because it was pretty severe. And in 3 days, she came to church. And she walked in the door, and I said, how are you doing this? And it was pretty much healing up very good. Well, the other thing that aloe is very good for is hemorrhoids. And we're going to see some other things that are good for hemorrhoids, too. This is just, boy, it froze good, too. This is just water in here. But if you don't have a plant, doesn't mean that you can't use it. But what we do is, if you don't have a plant, you can buy gel and you can buy juice, and you just fill up a glove like this and then take it with a clothespin and hang it on the rack in the freezer. And then it will freeze it. And then you take it out and you pop these things out of here. And I don't know, oh, here comes one. Now, this is just water I have here, not the juice, but this would be the juice that you would use. I have to tell you a funny story about this. Here's a nice, see, look at that, shape just nice. It'll go in so good, and it dries up hemorrhoids very well. And then you leave the rest of the leaf of the plant. You just fillet it like this. In other words, first you take off all the thorns, and then you do this. And then fillet it means you just take this top piece of skin, not the rounded, the flat side, like this, and then you have all that gel. Now, it'd be nicer to have a thicker leaf. And then you just make this shape of a suppository. I put it on a dish, and then, and I should have a toothpick, but I don't. Can you just see it? Shaped just like it, and you put this on a little dish, and you can put a toothpick in the middle of it, and then you freeze them. Now, I know when you go to bed at night, you slip it in, you can put paper towels in your pants or something like that, and you will have, like, for just a minute, it'll be, you know, it'll feel cold, but people that have hemorrhoids, it's a little hot anyway, you know, so it can have a, but it'll feel good, you know, type of thing. So anyway, and it works really good, people. So one day I went into to go hang up my glove at Uchee Pines in the tea room, and I noticed when I got in there, they had the glove filled up to all the way up to here. The thing was about this long. And I looked at that and I said, oh my word, who is getting this one? And so I thought, I thought, I got to find out what student is using this, you know. So I found the student, and I said, does he have it was a male that they were using it on, does he really have a hemorrhoid problem? Oh yeah, he has a hemorrhoid. I said, well, how does he make out when he puts this in his rectum at night. And he said, well, you know, he wiggles around and he, a little bit. He said, but he makes out and it's really working good. And I said, well, okay, but just next time you don't have to have it this big. You know, it could be this big. So I tell you that story, don't make them, they don't have to be that big, you know. Oh, so many funny things. And, you know, that makes your work pleasant when it's all these funny things that are happening. Now I'll tell you a little bit about charcoal, how well charcoal is used. Do any of you know in Japan, when it melted down, do you know what they still use? It's charcoal. They use a lot of coconut charcoal because it goes further, but they're sopping up that area with charcoal. In Chernobyl, they were using clay primarily, and zeolite, which is another type of clay. And they over in Chernobyl, they took the clay and the zeolite, and where it had melted down and it was all still melting, they made mountains of it over the meltdown, the radiation. There was, and you know, everybody, I don't know if anybody remembers when Chernobyl melted down, they made everybody leave. Just they had to go with the clothes on their back and leave that part of their homes and everything. And it was heartbreaking just to see that happening. But there was an old man and his wife, they were not going to leave, and they somehow beat it and nobody caught them. And they got big chunks of the zeolite, which is like a clay, it's white, and they went to their little property and they broke it up and they put it all over their soil, the zeolite, and then they took it daily themselves. Well, when they all came back to check the area about a year later, nobody would go in. You know, they came in with the big suits and the mask and everything on. They found this couple there. And they said, how did you manage to stay here? And you're still living. They checked them out. They had no radiation in their body. They took samples of their soil all over the place. Now, mind you, they're surrounded with it, but they took samples and they had no radiation in their soil. So that tells you how really good this stuff will absorb the radioactive materials. So it was amazing to know that. To know how well it works in lots of circumstances. And so I would never go anywhere that I didn't have clay and I didn't have charcoal, simply because of what it will do for the body. I think the next thing to charcoal is clay. I think clay is another one of the most wonderful properties that you could ever use. Most of us are mineral deficient, and especially trace mineral deficient. Most of us are. Many of our problems that we have is just a result of we don't have sufficient minerals in our body, because our soils in various parts of the world and various parts of the United States are depleted in minerals. And we need minerals. They're the catalyst, you could say, to help us absorb our vitamins, our nutrition from our food. Without it, we don't absorb properly, and we don't utilize it properly in the body. So how would you get your minerals? Well, now, number one, what is clay? It's just dirt. It's just really dirt. It comes in all kinds of colors. I've seen all kinds of colors, blue and green and red and gray and white. And when you think about it, what are we made out of? We're made out of dirt. We're made out of clay. So that's why it works so well on the body and works so well in the body. I sometimes will forget myself. You know, clay is alive. It is a living, what's the right word? Substance, but it's dirt, you know. And so when it's placed inside the human body, and they don't know all the answers to this, it knows exactly where to go and exactly what to do, unlike other things, but it knows what to do. That's why they say when you start a clay regime, whether it be a poultice on a certain area of your body, whether you're taking it internally, don't stop that regime for at least 10 days. Because if you interrupt it, you could create a worse problem for yourself. And so, and don't put clay here on your knee and then up here on your elbow at the same time. It needs to go to work at one area so that it can bring about the healing in that area. It acts like it says with wisdom. Clay is a living, beneficial substance that provides vital energy for the human body. Now, let me tell you, if you start taking some clay or getting, you know, they actually have a mineral out there that's just made from clay, and you start taking it, within a week's time, you're going to feel different all over you're going to have like energy, you're going to start sleeping better. In fact, the absorption power is very unique. It pulls, as I said earlier with charcoal, it pulls the toxins out of the body because of the clay is electronegative, toxins are electropositive. They can't escape it, if you know what I mean. In other words, if you take clay into your body, these poisons and toxins that are in there cannot escape it. It's going to get caught with the clay and taken out of the body. I mean, that's wonderful to know that it's going to work, in other words. And it's very antiseptic, it's anti-inflammatory, it's anti-carcinogenic. You know, people that have food allergies start taking clay, they start seeing a difference in that. It removes heavy metals. I talked to a man who has a big clay industry, you could say, in California, I think it is. And he had lots of mercury fillings. But he didn't want to go to the expense and the painful work of it to have all those fillings removed. So he decided he would experiment. So he takes clay every day. Then every 3 months, I think he told me, he would go ahead and have a hair analysis and to check to see did he have any mercury in his body, and he never had any mercury in his body. In other words, by him taking clay every day or every other day, he did a big regimen in the beginning, and then he backed off and just did it like every other day or every three. He's never, no matter how many times he does the test over the years, he shows no mercury levels. But he still has all the mercury in his mouth. And if you know if you have mercury, every time you chew, you express the mercury. And so I thought, my word, people only knew that. They spend $10,000, $15,000 to have all that taken out. If you take the clay, it takes care of the mercury in the fillings. But not only that, it takes care of you and gives you the minerals that your body is craving to have and doesn't usually have. It promotes wonderful healing. It's an incredible detoxifier. It's wonderful for the liver, excellent in digestion, great for acid reflux to take clay. And everybody wants this pH balance. Well, guess what's pH balance? Is clay. Clay is very pH balanced. Now listen, there is a bentonite clay that is very good for osteoporosis. And there's a lot of that. It's not so much with the black folk because you have good bone structure. However, I've run into some situations, and this is one symptom of osteoporosis. Vitamin D levels low. Vitamin D3 levels that are low is you think you have arthritis and you're aching all over your body, and it's nothing but D3. And then you can start an osteoporosis situation, even though it's not prevalent among your culture. You know, I wish I had your bones. But anyway, so if you have the problem, and people don't know this, the astronauts, when they come back from space, you're probably aware, many times, depending how long they're out there, they have to carry them when they bring them out because they're so osteoporotic, their bones are like mush. And so they have to keep them in the hospital for I don't know how long on rehab. And you know what they use to build their bones rapidly? Not medication, clay. That's what they use to build their bones back rapidly. So it's something to know for people that may be suffering from that. And listen, you only have to go out in the sun. I have a very good friend, and she's of your culture, and she just ached all over her body. She was feeling so bad all the time. Finally, the doctor said, let's do a D3 on you. She didn't even register. It was so low. And it wasn't arthritis. She thought she just had lots of arthritis. And so, like I say, I know her personally. As soon as she started taking her D3 and getting out in the sun a little bit, if you just get it on your arms and your face, you'll get, and if you don't want to worry about your face getting too dark, well, don't get it on your face. Cover it up and get it on your legs, get it on your back. Your back really absorbs it good, okay? And because how it happens is you have cholesterol under your skin. When the sun hits the skin, it affects the cholesterol that's under the skin, and it makes your vitamin D3. So if you take vitamin D3 and then you get a little bit, 15 minutes of sun, you're going to have a much better build up quicker in your body by doing it that way. So don't worry about, your skin getting a little bit darker. If you go out for 15 minutes, just if you don't want your face, then just cover it up somehow and get it on your back. Nobody will see that most of the time, And you know what? We told that at Uchee Pines. And, where modesty is a big thing at Uchee Pines, where I happened to be in the dining room one day and happened to look through the dining, and there's all the women out there with their backs bared. And I went running and I said, we got to get the women. We got to get them back where they can be. Everybody wanted to strip down and just get their bodies out in the sun. It's funny how people do things. You get a big kick out of it. But anyway, so we started having him we built sunrooms then, and we got him in the sunrooms. And it is the most wonderful treatment for skin. It's used in all the spas throughout the world is the French green clay. Now, periodontal issues, my husband had some. We used clay, and it's pretty much cleared it up. It's very good for that. You brush your teeth with it, and then you let it sit in your mouth for about 5 minutes or so, and then you can just rinse it out. And that will start to help to clear that up. Abscesses, it goes on. It's like charcoal. It's just one thing after another that it works for. Wounds and cuts, infections and bruises and, just everything you can think of, clay works on. It really is very much like charcoal. The only thing clay has differently is the fact that it deposits as well as take out. It deposits good things, which is the minerals, and it takes out what does not belong there. That's the difference between it and charcoal. Because right here it has it. Let me see. Right here's your trace minerals. I guess we know absorbent type of mineral clay, beneficial for removing they're reducing inflammation, detoxifying the body. Some people do much better with clay than they do with charcoal. I kind of go both ways, and right now I'm really into clay. I'm taking it for myself because I realized all of a sudden I was some mineral deficient, and within about 5 days I felt like a different person as soon as I started taking the clay. And it's hard nowadays to not be mineral deficient, and especially in the trace minerals. Again, the same thing goes for medications. Now you can, and with charcoal as well as with clay, you can have some constipation, and if you do, then just take some psyllium or take some flaxseed or take some chia seed. That's really good, and that will help to start your bowels moving right. Many times we have those kind of problems because we don't eat enough fiber. That's the biggie. And if you really want to do something about having constipation, start eating beans on a regular basis, and you'll find that you will start going to the bathroom pretty regular. People they never want to talk about that part of the body. They never. You know what? I'll say one more thing here for you men that are in here. You won't go get a physical. You don't want anybody to look at your rectum. You don't want to check a stool or any of that kind of thing. And I run into, you don't want that prostate checked, and so what happens? Then they end up with, because you have to bend over, the men, and you have to stick your finger in the rectum to fill the prostate. And men don't want to do it. And you're foolish for not doing it. Because I know so many men, I know one right now dying, my son-in-law, he's on the bridge of it. And because they won't go, they come down with prostate cancer or rectal cancer, all because they don't want to show their hind end. Well, nobody wants to do that. But it's foolish to be that silly. So I'm giving you all a lecture because I know you all do that. You won't go, so am I not right? That's right. Yeah, the women will tell on the husbands. They all tell, you can't get my husband to go to the doctor. He don't want to be checked. It's not going to go away if you got the problem. You're not going to, and I'm being just up front. I'm talking straight because that's really where the issue is, and that's why they don't want to go. And really, don't go to a woman doctor, go to a male doctor, if you're worried about that. Okay. If you have high blood pressure, really high blood pressure, then you want to go slow, small amounts of clay until you get your blood pressure down and find out why you have high blood pressure. We know that many people have high blood pressure because there is what we call the mind-body disease. What goes on up here goes on down here. And if we deal with this, this will correct in many, many things. We're teaching more of that at Uchee Pines now. In fact, all our patients, we have classes that they go in every day to learn about that. Once begun, again, do not interrupt the treatment. Clay can provoke reactions that you don't want to happen if you interrupt it, or if you change spots on the body. You want to always complete at least 10 days with whatever it is that you're doing. And do not, and this goes for charcoal as well, apply it over the abdominal area after eating. The last, I was over, I guess it was the Virgin Islands, everybody, we had 85 in the class, and everybody wanted to do the facial, including the pastors that were in the class. All the men wanted to do facial too, so we all, I had pictures of it. It was really cute how there everybody was with facials on, you know. And, but it's beautiful for skin. You got skin that you want to do something with, it makes beautiful skin. Or anywhere on the body. You got any kind of abscesses, infections of any kind. It's wonderful. I think that's the end. Unsafe. Never use, yeah. Be careful when you buy the clay. You can go on the internet. There's several places, some good, I think I might have it in the book. I'll look to see, but I think I may have a couple of different places that you can buy some good clay. You don't want to go buy the clay that they do pottery with. That's not been the impurities taken out of. But let me tell you what, at Uchee Pines we had an old bathtub, and this goes back a lot, 25 years or so ago. We had an old bathtub in the back of the Lifestyle Center, and we built a screen around it, and we dug 3 foot in the ground, and we got that old red clay, you know. Oh, what a mess that is to work with. I'd rather work with the green clays any day than that red clay. But you know what? We'd fix it in the bathtub and with the water, and we'd get it nice and, you know, pudding-like, and then we put the patient down in it. And we still got wonderful results, even with that old nasty red Alabama clay. Yeah, make sure it's virgin clay. Extracted from the quarries. Oh, let me show you this. Why? Just one more little thing. I forgot. She just reminded me of it. When you start taking clay internally, you get yourself, now this time you level the teaspoon. You just, at night, you just sprinkle this in here like this. See how it's going down? You know, and I might help it a little bit. And you let it sit all night, and in the morning it'll be settled in the bottom, all of it will. It'll be sort of a little clear, slurry type of water, and then you drink it. Do that for about 5 days to get your body used to taking the clay. And then you can start out mixing, even, you know, if you're working into it, then you can mix a glass after the 5 days of drinking the slurry water, and you're doing okay with it. It's not affecting you adversely like constipation. It shouldn't affect you any other way. And then you can go ahead and start taking a full teaspoon, or you could start out with a half a teaspoon, whichever way you feel is best for you, and you'll know how your body's reacting. And then you can just mix it and drink it on down. This, you can, in the morning when you start drinking, you don't have to drink the whole thing. You can drink half of it in the morning, and then in the middle of the day you can drink the other half. And sometimes I stir the rest of it up and take it. I'm not affected by it. I was in the beginning. I had constipation problems with it, but I don't anymore. And so I'm glad for that. I've done it enough that my body says, okay, I've got to do this right or else. So thank you for your attention, and I hope that you have gotten some benefit out of this.